monthly series. We're going to be getting started here in just a moment. While you're finding your seat, you're coming in, you're getting settled, we have a little icebreaker for you, just a little something to answer in the chat. If you've been here for the last couple of weeks for this kind of CAP month series, we want to offer an icebreaker maybe that sums it all up. And the question is, what do you love about your profession? Panelists, you're not immune to this question as well. I'd please encourage you to drop it into the chat, but what do you love about your profession? You can start dropping those into the chat now. That is your icebreaker. The children. Oh, working with youth, seeing lives changed. Being a service to the community, the success stories, absolutely. These are great. Using data to tell stories. Who's our data person? I love that. Helping others, interacting with the community, seeing the impact, making a difference. Community engagement, holding babies. I love that. Wonderful. Research, reunification services. These are great. So for those of you joining, hello and welcome. We're going to get started here in less than a minute. And we're answering in the chat a quick icebreaker. And the question is, what do you love about your profession? I'm asking you to drop that in there. And you can see from other professionals, helping professionals here, it looks like many of the things you love are similar. Strengthening families, helping, empowering individuals. I love that. Wonderful. I'll give you just an extra second to drop your responses as you think through that. These are great. Seeing individuals break the cycle and succeed. How wonderful. Great. And with that, I'm going to officially kick us off. Thank you so much for participating in that icebreaker with me. This is the final webinar in the Child Abuse Prevention Month series. My name is Jessica Matley. I am a training coordinator with the California Training Institute, but some of you probably know us best as Caltrin, and I'm going to be your host today. Today, we're going to be wrapping up our Child Abuse Prevention Month webinar with a very dynamic panel who will be responding to the shift from mandated reporting to community supporting. If you'd advance me to the next slide, please, I want to give you a quick note. We will only be going until 12, all right? So we have less than an hour here to allow the opportunity for folks to join the Safe and Sound Lunch and Learn webinar. And it's titled Focusing Upstream, the Role of Communities in Keeping Families Together. It'll be happening directly after this. The webinar will be a great follow-up conversation to our discussion today, and that link to register for the webinar is going to be shared right now in the chat for you, so make sure that you join. Great, and if you'd advance me to the next slide, I will keep this part quick. As you can see, we have just a brief agenda for you. You're going to get some hello, how are yas, some welcomes to the webinar, and then we're going to follow up with some great panel discussion. And some other thing to know, you as a participant, you're muted. But if you want to interact or if you have questions, please feel free to use that Q&A function for any questions that you might have. We'll try our best to address your questions, but for anything that cannot be addressed or any additional questions that might arise, please feel free to email kidsday@dss.ca.gov for a response. Just so that you know, slides and the recording will also be provided after this presentation. So what I'd like to do now is turn it over to Cheryl Treadwell, who's our Chief of the Safety, Prevention, and Early Intervention Branch at the California Department of Social Services, to introduce our first presenter. Good morning, Cheryl.
Good morning, and thank you for handling all that long title of my branch here at CDSS. Thanks to all of you for participating and becoming part of this conversation, this effort that ultimately we expect to become more of a reality as we make this shift to community supporting. It's always good to know that you have help in this work. So I wanted to express my gratitude for our partners, the CAP Center, Child Abuse Prevention Center, Casey Family Programs, Safe and Sound, the data experts from Chapin Hall, UC Berkeley, our county partners, our parents' lived experience thus far. We've heard firsthand from the parents that have experienced our system and the importance of this movement and why it should be now. And we've also heard from communities and counties that are already doing this work. So today, as we stated, this is our wrap up, and specifically to focus on how it's going to require all of us to work together so that we can spread the word and lift up the awareness about this change. But before we hear from the panel, I'd like to introduce Dana Blackwell. She's with the Senior Director at Casey Family Programs over Strategic Consultation. She's been a lockstep partner with us in this work. In her role, you know, she's responsible. Many of you know Dana. She's very responsible in this workspace around statewide partnerships and initiatives and system improvement type activities. She's going to share with you a brief description of the Child Welfare Council's context for the prevention and early intervention recommendations. I will now turn it on to Dana.
Thanks, Cheryl. And I want to congratulate all of you for a very successful CAP month, a webinar series that I know many, many people have benefited from. And it is part of building a coalition of improving the outcomes for children and families. So congratulations to you all. I apologize that all you see is a tile of me. Technology is great until it isn't. The PEI recommendations, the Child Welfare Council let me just give a little bit of background. The Child Welfare Council is a legislative mandated body that's chaired by the Secretary of Health and Human Services and the designee of the Chief Justice. Its membership includes a wide array of child and family serving system partners. Can people still hear me?
Yes.
Okay, because my screen just went black. So I just want to make sure you can.
We might have, Dana's little computer might have taken a brief pause, okay? A little break here. So I will just kind of step in if that's okay. And if Dana jumps back in, we will continue along. But something that I wanted to highlight, I think Dana might come back in, she might fill in some of the blanks for us. But what we'd like to do is just kind of maybe introduce some of our panelists. And this panel is dynamic. We have a lot of great speakers, and we actually have some questions that we've prepared for the panel that we would like to ask them. And like I said, if Dana pops back in, we're going to just take a brief pause and she can finish her thought. So what I'll do now is I will introduce each of our panelists. I might be on our panel slide. If not, if you'd please advance me. Well, let me just give you a very, very brief info. First, we have Damian Ladd with the CDSS CalWORKs Engagement Bureau. So hello and welcome, Damian. We're excited to hear from you. We also have Lourdes Perez with All Children Thrive. We have Sergeant John Saito with the Sacramento Sheriff's Office. Jessica Ampa with the CalFresh Emergency Food Section. Lynn Van with the CalFresh Health Living Program. Kelly Gresh with the Child Care Resource and Referral Network, and Yolanda Trevino with the Pasadena Altadena Coalition of Transformative Leaders, a family resource center agency. Welcome all, and thank you all so much for being here. I'm very excited to hear some of your responses to these questions. I believe we can take our slides down for a few in a few moments. So what we're going to do is we're going to jump into a few questions. We've prepared, let's call it 5 or 6. And I'm going to welcome panelists to jump in and respond to some of these questions. Now, as you all know, we are going to be here until noon. So we're going to kind of cut it down a little bit on time. But I'd love to hear from at least all of our panelists by the end of this Q&A. I think we will. My first question for the panel, if I can maybe have 1 or 2, maybe 3 panelists, please share with us an overview of your work and describe how mandated reporting is related to it.
Good morning, Jessica. I would love to share a little bit about All Children Thrive, and I'm Lourdes Perez, Director of Local Policy with Public Health Advocates. Public Health Advocates is a partner in All Children Thrive, along with UCLA Center for Healthier Children, Families, and Communities. All Children Thrive is a statewide initiative that helps California communities prevent and mitigate the effects of adverse childhood experiences. And we work towards this by shifting power in local government and empowering local youth and adult residents to create sustainable policy change that centers children and their families. We also build capacity in communities through training and coaching. We provide funding for communities to do this work. And we also use community data, raising awareness around ACEs prevention and social determinants of health. We develop resources and connect individuals within and across the state to do this work. We are currently funding 18 community-based organizations across the state, including tribal nations, to work on this prevention of childhood trauma and also implementation of policy strategies that create protective environments, promote healthy child development, develop youth and engage them civically. And we also support strengthening economic supports and expansion in access to safe and stable housing. We do plan to recruit and fund an additional 12 communities within the next year. And ACT is about preventing childhood trauma, and we know trauma can occur if we don't consider protective factors in the mandated reporting. So we are intentionally working to prioritize children and families' needs, strengths, and supports. And as we implement a holistic approach to our work, we integrate protective factors such as social and emotional competence of children, social connection, concrete support in times of need, and parental resilience. The way ACT is structured, it is about a community-driven approach. So we have core team and a design team in each of our communities that have different stakeholders, from residents to institutions to elected officials, city staff, other community-based organizations that partner on the work, and they all come together to think about the best policy and systems change approach for the child community. So we believe that it is critical to interact at the policy level to shift from mandated reporting to community supporting. And the interest of mandated reporting is to keep children safe and away from harm, as that is our interest as well. So thinking about the child's community, trusted adults, and how that community can be better supported for the well-being of the child, it really requires addressing the root causes and creating these policy changes that are sustainable in communities. So we must reform our policies and practices regarding mandated reporting to not cause more trauma or harm. And again, the ACT model is a good one to think about as we are reforming our mandated reporting approach. And ACT's vision is to have a state where children, youth, and families thrive. So in order for this to happen, we need to work together. We need to collaborate across sectors. And I'll leave it at that.
Thank you so much, Lourdes. Really appreciate that. Do I have any other panelists that wanted to add to that discussion?
I'd like to. This is Yolanda Trevino, Executive Director of Pacto. And greetings, gentle breezes from Pasadena, California, where we are located. So I am an indigenous Mayan immigrant from Guatemala. So a lot of the work that I do is informed by my upbringing and the indigenous values that we have. So let me date myself and say that a quick overview of my work. I started in 1992 with the first Family Resource Center that had funding from Healthy Start. We were one of the first cohorts. This was in Pacoima, California, and our work at that time was very seminal and very innovative, because from the very beginning, I knew that we had to include our entire community. So we had parents that were part of this, youth who were part of this. So this was very much a community-driven program. So since then, this community has become very famous. I'm not going to stay on that, but if anyone is interested, you can look up the Van Family Next Century Learning Center for your background and information. So let me move now to currently where I am. So currently as the Executive Director of the Pasadena Altadena Coalition of Transformative Leaders, it's a long name, so we call it PACTO. We serve more than 3,000 people per year in the greater San Gabriel Valley, and we continue to serve in Pacoima. So we are a direct service organization. However, we have the finger in the pulse because the work that we do reflects the community that we serve and partner with. So parents are on our board, youth are on our board, and so they inform and drive the programs that we offer. So I don't sit here as the executive director and say, oh, family is needy and needs this and that and the other. I would like to just highlight that during the pandemic, we were one of the few places in Pasadena that did not close. We went into full service in opening a food pantry, and we served thousands of people a week. And in addition to that, we partner with the school district in Pasadena, and we deliver 260 meals a day for children, including the weekend. So that services pivots to what is the emergent need of the community. And that's really how we function. I think it is very important, and I'm really delighted, as I did myself, that we are moving in this direction, because as an agency that provides direct services, and we offer comprehensive wraparound services, including parenting, education, etc. Our classes, we offer 3 classes simultaneously, and in English and Spanish. We work with indigenous people that only speak their indigenous languages. And our classes are full because we don't charge a cent for any of our services. And we are court approved. All our classes are court approved. So believe me, our classes are packed. 30 at minimum of 30 parents in the class. And we always have a huge waiting list. So unfortunately, part of the reason that we're so busy is because the approach, as you know, in the child welfare system has not necessarily been for prevention, has not necessarily been supportive of families. You know, in their own way they do, but there's a lot of trauma that happens when families, because they have issues in attending to the children, and many of the issues, unfortunately, have to do cultural misunderstandings, issues with not having enough to support them because the family works 3 or 4 jobs. So we work with, I'd say, in immigrant families that are that suffer the brunt of not necessarily feeling a supportive approach. So we believe that this movement is really critical because our parents and families that we work with, yes, they're part of the problem, but they're also part of the solution. So I do hope that as we're moving forward in this, there's thought to engage families. What are they best thinking? What do they envision for themselves? So this is kind of how we work. And I do hope that as we are changing the system, that there is a space for the families that end up, unfortunately, being the brunt of our approaches that are not necessarily supportive, but really feel to the families more punitive. So there's a lot more that I can say, but I think it's important for us to explore this and to have, I think, a heart-to-heart with ourselves, with each other, and say, how do we shift? And we know that absolutely everyone, because we work with social workers all the time. And, you know, we want to support the work that they do, but how do we help them move to a place of judging the families where the families are afraid to connect with their own social worker that's supposed to be there to help them. So I don't mean to come down really hard on the institution such as it is, because I do understand the purpose is to help the families after all. I just want to really shout out how critical it is that the action and the movement, we need to do it now. It's that we can't wait another minute.
Great.
So I'll stop there.
Thank you so much, Yolanda. We really appreciate that. Thank you so much. The next question I have for the panel, if anyone's interested in answering this one, is your agency or program positioned to make the shift? And if not, what would it take to better prepare you to move in this new direction?
I can take that one.
Great.
My name is Kelly Gresh, and I work for the California Child Care Resource and Referral Network. We're a membership organization of state-funded child care resource and referral agencies, and I'll start calling them CCR&Rs for short because it's a longer name. Anyway, CCR&Rs, there's one in every county. They're funded by the California Department of Social Services, and they offer resources to the child care community, to families seeking child care, and then also to the communities at large. Many of the CCR&Rs are community-based organizations, and their workforce is representative of that community of which they work with. And so they understand the community's needs. For context, in California in 2021, there were approximately 37,700 licensed child care facilities. That includes both homes and child care centers, with about 706,000 spaces to serve children. That's a significant number of children for that reach. Parents often call the R&Rs in the beginning because they're looking for childcare or they can't afford childcare. But then childcare, it's not just a list, it's a conversation. And so that specialist is having that conversation with the family, listening to them, learning about what they're talking about, what their family needs, and the different services that they might be able to offer to them. And so the CCR&R provides information about how to choose childcare, the type of childcare, but also all the rest of the community resources that might be available to those families. So they're giving them information about parenting, child development, social connections, concrete support, depending on what the family's needs are. And then the CCR&R also provides support to the childcare providers. And so they're recruiting childcare providers. They're helping them through the licensing process. They're also providing them coaching, TA, and training, which is ongoing and responsive to whatever the needs are for the child care providers. In addition, the CCR&Rs also have existing relationships with the Health and Human Services agencies. For example, they have Emergency Child Care Bridge program for foster children, which is assisting resource families with navigation to childcare and to resources, as well as trauma-informed care trainers. And so the network being the statewide agency, we have local CCR&Rs on the ground, at least one in every county. And then we have those 37,000 licensed facilities, not just licensed providers, but there are staff within those facilities that are also there to provide supports. Now, they're also mandated reporters. And so when we think about, this shift, there's some things that probably are going to need to happen. And that's just, we're talking about an industry that is fundamentally built on love. Childcare providers get into this business because they love children. They also have this requirement for mandated reporting. So when we talk about this shift, when we think about their required training that they have to do, there'll have to be some supports, whether that's through messaging, changes within that training. And then for the CCR&Rs who also provide that support and training, whether it's through the licensing process or trainings that they provide afterwards, they will need that support too on how to help the child care providers change that focus. When you're a child care provider and you're a mandated reporter, there is a certain amount of stress that comes with that, as far as if you don't report, then you are now out of compliance. And then you have regulatory agency that's going to come and visit you and all of these other fear-based things that could happen. And so helping that to change, to shift from fear to strength-based will be important. Childcare is definitely in a position to help make this shift, as are the CCR&Rs that support them throughout the state. We adopted Strengthening Families framework, I want to say, about a decade ago. And so a lot of the work that we do within our structures and with childcare providers are based on the 5 protective factors. And so I think, making sure that we're involving the folks that are going to have to implement the changes and the shifts as we look at those policies and regulatory changes that will need to happen. And that includes all the different levels, the child care providers that are providing the services, the CCR&Rs that provide the support, TA and coaching, as well as the regulatory compliance. So community care licensing, everybody is going to need that support. What does it look like? When is it appropriate? And, what does that shift look like? So I think we are here. We are, very strong as far as the reach that we have in childcare, and childcare is part of that social fabric within every community. So I'm excited that childcare is at the table, and we look forward to working on making the shift with the rest of all of the partners. And thank you.
Thank you, Kelly. I believe there was one more panelist that had some thoughts about this as well.
Yes, thank you. It's John from the Sheriff's Department. So I supervise child abuse here in this region. One of the things I would say is, when I first looked at the headline of it, I was a little concerned because I thought, what exactly is this going to mean? And then the more I read and the more I talked to some of the involved people, the more I realized that this is going to be a real positive for us. We hope that in the law enforcement side, as much as I like to say, I don't like cops to shirk their responsibilities and say, not my job, not my job. This really is not our job, generally speaking. I mean, you really don't need to get the police involved in things that, frankly, are not police matters. So I'm very happy to see that a lot of the issues we're talking about here between poverty, general neglect, shortcomings in resources in communities, a lot of that sort of thing is going to be addressed with this rather than reporting it immediately to social welfare or law enforcement. I'm also really excited to see that, when the cops do have to go out on calls, and if there are any concerns potentially about kids on the call, we really only have one place to phone and report this sort of thing or try to get resources, and that's historically been CPS. So it's really great that we would have the opportunity also on the law enforcement side to have other resources to get a hold of and put the family in touch with, rather than feeling like, well, I guess we have to call CPS because I don't know who else to call. Now, hopefully we will have other places to call, and we can also provide that kind of assistance in that regard. So ultimately, I think it's going to be a very, very much a positive for us from the law enforcement side. And I'm really looking forward to this shift and seeing what we can do to help out with it.
Wonderful. Thank you. And you can probably see some of these little fun emojis popping up on your screen. Sounds like some people are excited about that too. All right. And moving on to the next question. If we move in this direction of community supporting, what opportunities do you foresee for your program and the families you serve?
I can answer this question.
Awesome.
Part of it. Yes, thank you. So greetings, Yolanda Trevino again. So this is really super exciting for us. And as I mentioned before, the time to do it is now. It couldn't be any sooner. And so for us as a direct service agency, we will have an opportunity to focus more on strengthening families and to work in a very different relationship with the child welfare system, because we know that our families are going to feel that they will be supportive, as opposed to have sanctions that feel punitive to them. And I think that they will be more inclined to do better, because we then can allocate resources and support to uplift their greatness. I think that families will thrive more knowing that we're here to support them. And so I I think it'll be super for us, not to have to worry, if you will, that, oh my God, this family doesn't have any food to eat, and how, and there are instances in which there are extenuating circumstances for this to happen. And as mandated reporters, we have to wrestle with what do we do. So I think it will be a great lifting of this heavy weight that we have when we serve families and community. Certainly will be, my job will be more joyful, I think. Thank you.
Awesome. Thank you. Do I have any other panelists that would like to add to that?
I would love to add to that, Jessica, if I may. As I mentioned, ACT works with design teams made of youth and adult members with lived experience, and they are the advocates for strong, healthy communities. They are the voice for social change and ensure that the needs of children, youth, and community are met. So these design teams could play a critical role in the shift from mandated reporting to community supporting by providing input directly to the task force and also helping with the education and information dissemination in communities and with the partners that we work with within the design teams. That could also help mentor and train community members and individuals with lived expertise to share their stories in a way that informs policy so that we create policy and practices reforms. And then ACT uses community data for ACEs prevention. We could potentially share our community data from these ACT-funded projects. And in addition, Public Health Advocates has a state policy department led by Dr. Flo Kofer. And through our state policy advocacy, we could also support the legislative reforms necessary to move from mandated reporting to community supporting. So this too is very exciting for us, and we would love to continue to be involved as this movement continues.
This is Deegan. I'd like to echo a little bit what Lourdes and Yolande said. So happy to be here, everybody. My name is Damien Ladd. I'm with CDSS, the CalWorks program, which is cash aid and services to needy families. And so we as well, are in the midst of kind of a culture shift. And Yolande kind of said it, that we're sort of trying to move our program, CalWorks specifically, and other programs at DSS, more towards kind of a human-centered, supportive approach and away from kind of a compliance-oriented, punitive program design. And so in that respect, I think CalWorks sort of fits in as more of an upstream support. We've implemented a few programs that are more associated with sort of stabilizing the family and strengthening the family. And so just would say that, as well, kind of echoing what Lourdes said, that there's some opportunities there, I think, for information dissemination and just sort of being a part of this more writ large culture shift that I think we're seeing across human-centered programs, human service programs.
That's great. Thanks. I want to kind of continue that thought, this idea of identifying what the opportunities are, but let's maybe talk about what challenges you might foresee as well. And not just identifying what the challenges are, but does anyone have any thoughts on how they might overcome those challenges? So for the panel, the question is, what challenges do you foresee? And do you have thoughts about how to overcome them?
I can take a crack at it, if I may.
Go for it.
So I think one of the challenges, not to be a naysayer, but I want to continue to feel like I'm inspired and we're moving forward with this. But I just want to warn us that changes can be messy. And as we're moving to a different way of being, that we don't get discouraged if we foresee, this is a mess, or so-and-so doesn't want to buy this. I think we have to stay on track. And the opportunity that I see with this is, please engage the very people that get affected on this. they are part of the problem, but they're part of the solution. And my experience is that they are pretty brilliant. My brilliance in doing this amazing work has been to get out of the way and give them an opportunity to voice their amazing ideas. So I think that's really a great opportunity. Don't be afraid of our families. I've never met a single parent, caregiver that did not want the best for the child. All over, I worked in 86 countries, and it's the same in any language, in any culture. We all want the best. We want our children and our families to thrive. Thank you.
Love that, Yolanda. One thing I want to highlight that you said in the beginning was, hey, change can be messy. To that, I want to remind everybody, J-curve, anybody? The theory of change, it gets a little bit hard before it gets a little bit better.
Yeah.
Wonderful. So that's a great challenge, and thank you for that thought on how you might overcome it. Anyone else have any thoughts about challenges and strategies?
This is Damien again. I could say from the perspective of providing support and attempting to sort of weave programs together. In that respect, I'm sure we probably all have encountered the types of challenges associated with attempting to braid resources and provide kind of a comprehensive set of supports and services to folks. And so therein, there's various rules that can trip people up, et cetera. So, I would just sort of, in that regard, offer that I find the most successful strategies for that happen really at the caseworker relationship level, and the ability to pick up a phone and call Yolanda or call Lourdes or call Kelly and talk about somebody that you're working with, and have the ability to say, oh, well, I think my program can offer this, and oh, I know, Lynn over there in CalFresh we could maybe give her get a connection there to provide some support for food benefits, et cetera. So, I think it's really at that, you can get sort of sucked down a rabbit hole of trying to read through statutes and regulations and figure out, is this work? Is this allowable? Can we use our money this way? I find that oftentimes just, being able to have that conversation and talk to people, a lot of that just disappears.
I like that. That
Yeah.
idea of, especially in this profession, it's not as transactional as it is interaction, right? And so you're like, exercise those interaction skills. I love it. And, I know that many of you panelists are intersecting with families and serving families in different capacities in different ways. So this idea of community supporting looks different for you. So does anyone else have any other thoughts for this shift and what challenges you might see from your perspective, and some thoughts on how you might overcome? And for those that are listening along, participants, if there's any challenges that you foresee based on how you're doing it or what it might look like for you, not just a challenge, but anything you might do to overcome it, I would welcome you to drop that into the chat. This is a great place to share those ideas. So for the panelists, does anyone have any additional thoughts that they'd like to contribute to this question?
Jessica, I have a lot of thoughts. As you know, I have a lot of years in the trenches, but one of the challenges that I foresee is that the change has to be at all levels, top, bottom up, sideways, because if we don't do that, this is not sustainable. And I think it's going to be also from our schools, like social workers, when they go to school, what is the message that they're getting? Like, I'm a psychotherapist, and I remember fighting the whole DSM-3 at that time. And it's like, why am I going to put people in a box? And I know there are some things that are needed, but to what extent do we become a system that is human-centered, heart-centered, as opposed to putting people in boxes, and you're this and you're that, therefore you're going to be treated like that. So I think the This is going to require a shift in all of our thinking. Social workers, anyone that works with families, to shift from we're like in control, we have the answers, to how can we arrive at answers together? How can we become more of accompanying families as opposed to I'm empowering them? That word, honestly, I'm so sorry, it makes me want to throw up, because we don't empower anyone. People come with their own power and we get out of the way and we support and we create the kind of conditions that they can find their own power. So I'm going to be quiet before I get in trouble.
Thank you, Yolande. And I did see, Lynn, I saw that you had unmuted yourself. I caught it so quickly. Did you have a thought?
Yeah, I just kind of wanted to talk about some of the supports that my program provides.
Great.
As just wanting, of course, you all know my name is Lynn Vanna. That's on my screen here. I'm the CalFresh Healthy Living Section Chief with the Department of Social Services. CalFresh Healthy Living is a federally funded program, also known as SNAP Ed. We are a supplemental program of CalFresh that provides nutrition education to underserved and low resource communities to make healthy choices within a limited budget and choose physically active lifestyles. So oftentimes, we overlook how trauma and adverse experiences, within an individual, family, or even community can lead to poor nutrition and poor diet that result in poor health outcomes and diet-related diseases such as diabetes or obesities. And this is most likely due to the fact that this is not a priority for most of those that are experiencing this type of trauma or adverse experiences. So, studies have shown that people with healthy eating habits and are physically active generally have positive health outcomes and have improved social and mental well-being. So, our CalFresh Healthy Living services are provided at, the community level in a variety of settings. Like, for example, we partner with schools, with food banks, churches, local health departments, group homes, before and after school programs, congregate meal sites, senior centers, even farmers market and family resource centers, to name some. We may already be serving these families and individuals through, our multi-level interventions within the communities in the settings that I just mentioned. So I do see, further opportunities to build partnership in local communities where our services can provide, and implement these type of services to the community in a more targeted way.
That's great. Thank you so much. And I have one final question for the panel. And we have, we're going to call it 9 minutes or so. I'm curious to know, what do you see as your agency or program's greatest role in making this shift?
I can take this one, Jessica, as I don't think I've got a chance to provide input yet. Good morning, everyone. My name is Jessica Ampa. I'm the Emergency Food Program Section Chief in the CalFresh and Nutrition Branch at the Department of Social Services. So I oversee all of our state and federally funded emergency food programs that our food banks provide at the local level. So I think and then in my previous role, I was the CalFresh Outreach Manager. So our CalFresh Outreach team oversees a network of application assisters that provide outreach and education regarding the CalFresh program. And the goal is to always increase access and awareness of the program. And so I think for the individuals and the communities that our programs serve, I think everyone, may know that there's some at the highest risks at being maybe affected or being potentially reported for child abuse. So I think the more access and information that they have to our services, this could likely decrease that happening. As we know, a lot of the times when people have access to, social service programs, it can be, for a temporary period of time or to allow them to get on their feet. So then they're no longer in the position that they were previously, or I guess you could say the fragile state that they were in. So I think it's really just about spreading that information and awareness, making sure that we all, share information and resources. And I know that a lot of the times at the local level, they already do that. When you go to a food bank or your local county social service office, there's a variety of information regarding public services and programs that are available. So just making sure that information is shared across the board. If there's any, change to regulations or reporting requirements, making sure that's shared throughout all of our public facing programs. I think especially at the county and the local level, or even at the state level, we can share that information out. Although we're not on the ground implementing the programs, we do provide oversight and have a lot of opportunities to provide that statewide information. So even partnering with our child abuse prevention partners at the department just to share out. I think that would be great. I think there's a lot of opportunity there just to share that information. I think the more the better. I know previously to being on this panel, I wasn't aware of the change. So I think the more we're proactive about sharing information with one another, then that's going to help spread the information down to the local level with our county social service departments, our food banks, our local implementers, and then eventually to clients and families.
Thank you so much for sharing that. That's great. I think we have time for maybe one more panelist if anyone has a thought for this question as well. As a reminder, it's what do you see as your agency or program's greatest role in making the shift?
I can answer that. I think that I see our program, well, childcare is one of many partners. This won't happen in a vacuum. We all have to do this together. And so as one of the partners, I see childcare on all different levels, whether we're talking about the network working with state policy or getting messaging out, local CCR&Rs at that state, at that local level with their workforce that is so embedded within, the communities, and then the childcare providers themselves that are there to support the family. They hear the families, they see the families every day. So helping to get that message out, to get those resources, and maybe even gap analysis, to where are the gaps in the resources within those local communities, and then, seeking the funding and then providing those resources that help the families. So that, like Yolande said, they can do it. We trust within the families, they have the power to do it. Sometimes we just need to help get the messaging and the resources out there. So I think childcare is one of the most important partners in making the shift. So we look forward to working together.
That's wonderful. I actually am excited to say I have time for one more. If anyone has I have one last panelist spot. If anyone would like to add to this portion.
I'm resisting the urge. Wanting to give someone else a chance.
Go ahead, Yola. I was just going to say, I kind of touched on it earlier. I think it's kind of about a culture change and sort of a shift in thinking and, shift in thinking away from, sort of compliance and sort of a punitive way of thinking about people who have, hit a rough patch for some reason or another. So, it's about
a
mindset of support. Go ahead, Yolande.
Yeah, I'm so sorry.
Yeah.
I just think that the money that we're going to save and being punitive, it should go to family resource centers so that we can do more of the proactive work and prevention work.
All right. Well, it sounds like we have heard from all of our panelists throughout the duration of this little Q&A portion. So I just want to say thank you all so much for your contributions and your perspectives. Thank you all to attendees for your emojis as they said things that you really connected with. We know that serving families does not work in isolation of one another, and this will be a combined effort to continue moving more upstream to serve our families. So thank you for what you do and for what you shared today. I also wanted to add one quick thing. I want to add that there will be a future webinar that goes in depth with the PEI recommendations. So now I'm going to turn it over to Dana Blackwell to share some final thoughts before we close out today's webinar. Dana, take it away.
Yes, fingers crossed. So transformation. Oh my God.
We can totally hear you. You're doing great.
Okay. Transformation of our current system of child welfare is necessary and possible. If we think about the arc of change, the evolution of child welfare, our aim has changed over time. We used to believe that the separation of children from their families was the in the child's best interest when child welfare was involved. Now we believe that keeping children safely with their families is essential to child well-being. I remember when I started in this field, instead of striving for permanency for our older youth, we focused on preparing them for independence. Now we know that family and family-like permanency and connection is an important factor in the long-term success for our kids. What is our aim today? Well, we've heard a lot about that. What do we believe? We've heard a lot about that too. We believe that all families need and deserve access to high quality, timely, and culturally relevant supports and services. We believe that getting help should not require system involvement. We believe that engagement with communities, especially communities where disinvestment has led to inequities, is foundational to keeping families strong, children safe, and communities thriving. Today, transformation begins with building on the momentum from this CAP webinar series. It begins with building on the approval of community pathway recommendations. It begins with continuing our support of comprehensive prevention planning in each of our counties. Transformation of our current child welfare system will require collective commitment to building strong community pathways across California so that we can safely narrow the front door to child welfare intervention by supporting children and families in their communities. I'm excited to be a part of that collective commitment, and I'm excited about the future. Thank you, everybody, for sharing all of your thoughts and your commitment to this transformation.
Thank you so much, Dana. I believe we might have some last closing words from Cheryl.
Thank you, Dana. What a great panel. I tell you, this work should excite everything you ever envision when it comes to helping and learning how to respect the power that families hold, whether you operate as a leader, working in an organization, in the community, as a member, as a parent. You've all worked for a moment like this, and the vision to supporting a culture change and seeing these challenges as opportunities. We have an opportunity to bridge the gap between government, institutions. We've heard that today. We have an opportunity to bridge the gap with the communities as we move to meet the families where they are. We think that strong families make strong communities. We rally around what we heard earlier today, and I listened intently. We all want the best for the families that we serve. We all want our families to thrive, right? So let us be about the change, as we heard today, at all levels to sustain this change. And then we sort of get out of our own way and be open-minded about this work. Let's find a way together, and we want to hear about what you need out there, the Office of Child Abuse Prevention. We want to join with you in making this transformation happen. You are the agents of change, and we urge you all to make the pledge today to take the action in your commitments, in your communities, to lead these efforts and lift up families. Last but not certainly least, we thank you all for the support that you do in the work you do every day. And we are pleased to be partnered with you. And remember this, you don't have to report a family to support a family. And that might sound like a tagline, but that is the essence of what we're trying to get to. And I really, really appreciated the comment today that I heard earlier today by the sheriff. I think that is a recognition right there of culture change just in his own statement. So I honor that, what I heard, that connection today. So everybody have a great afternoon. And I want to thank Caltrans and the rest of the staff for pulling together this great webinar. Thank you.
Thank you, Cheryl. And thank you, Dana, for these closing thoughts, these wise words, these important ideas today, and for supporting these efforts. So before we leave, Cheryl talked a lot about making the commitment, right? Before you leave, we have a little poll for you, all right? A question, an important question about commitment. And that is, are you committed to making the change towards community supporting? We'll give you a second to respond to that. as we tally them up, looks like we have close to 50%. Oh, okay. We'll hang out here until we have about 60% of you. Great. Wonderful. All right. It looks like we might be able to share those results if you would, please. Thank you. Great. And thank you so much to our panelists, our participants today. We will be sending out all of the materials, the recording, and a brief questionnaire for the session today. We appreciate you completing the questionnaire to provide feedback on today's webinar. Please don't forget to register and join the Safe and Sound Lunch and Learn webinar happening in 4 minutes. You have just enough time to refill that coffee cup. The link is being shared in the chat again, and you can get registered from there. Thank you again. Have a wonderful week, and we'll probably see you in the next webinar. Have a great day.